Good afternoon and welcome to Marshall Parker and Weber's webinar, How to Shop for the Right Nursing Home. My name is Tammy Weber. I'm a certified elder law attorney, and thank you so much for joining us today. Let's get right to it. The decision to putting or placing a loved one or moving yourself into a nursing home is really one of the most difficult decisions people can make. So we want to back up and really look at what are the goals. So many of our clients and most want to remain in control and at home to the extent that they can. But there are many issues that they face with aging. So they look at them and try to figure out what is the best decision. And along with this, they want to know that they have financial security. So they want to know, will their money last for their life? And that's hard to figure out. So let's move through to some considerations for nursing home placement. Perhaps you or your loved one is unable or have an inability to take care of themselves. They might have a progressive disease like Alzheimer's, so they need some assistance. They forget to take their meds. They may not turn off the stove. They may wander from the house and not know how to find their home again. Or they may be cognitively fine, but had some health occurrence like a stroke or a heart attack where they need some assistance in taking care of themselves. So once you look at the considerations, you think about, well, what are the needs? First step, can we do this another way than a nursing home? So the first could be home support. So there are various agencies that can come into your home and provide assistance for you. There are also individuals who work independently that do this as well, but there are many considerations that you should look into. There's also an option of hospice, and that's when the individual has a disease or an advanced cancer, where it's gotten to the point where treatment can no longer cure or control it. And their life expectancy is usually 6 months or less. It just means that it's a realistic possibility that they may pass within 6 months. Many of our clients live beyond that, but that's a great program that may enable you to stay in your home. Another option are adult daycare programs. So, for example, in many counties, but not all, in Pennsylvania, there is the LIFE program, which stands for Living Independently for the Elders or Elderly. And this allows people to live in their homes, sleep in their bed, and then maybe go to the facility, the Life Center, 3 to 5 days a week, not on the weekends, and have all of their care coordinated through the life physician. Now, currently, with the COVID issues that we're having, people aren't going to the center, but they're receiving the services in their home. And with all of the things that we're going to talk about, a pandemic does change things quite a bit. So the next option would be, can the home be modified so your loved one or you can achieve your goal of staying at home? So for some people, that may mean putting a bathroom on the first floor or retrofitting a bit so it's safe with rails and things like that so one doesn't slip, or have transfer benches. Some people will be putting a ramp out front. So if they were wheelchair bound, they could get in and out of their house much easier. There are contractors that come out and look. And as with everything we're talking about today, the earlier you start the planning, or at least thinking about it and communicating it with your loved ones, the better the result's going to be. More options and not choosing those options if you're at the crisis. So after you look at potential home modifications to meet the needs, there are also transportation programs. So there are organizations, and they vary throughout the state of Pennsylvania, like STEP that provides transportation. And it's in various counties, and they'll pick you up on on their little bus, take you to your doctor's appointments, come back and get you. And depending on how far you're going and your income level, there may be a charge, but it's a great program. In addition, there are meal programs, and most people will know of this as Meals on Wheels. And there are requirements, as there are for all programs. But if you're homebound, meaning you don't go out at all, really just go to the doctor and maybe to church, a meal is delivered to you each day. Often that's about the noon meal. Pre-COVID, there was a volunteer that would come and drop off the meal, and often, depending on how much time they had, they would come in and speak with your loved one. So it's a nice touch, and just know everything's going okay, especially if you or your family lives far away from the person needing the additional assistance. How complex are the needs? So we dig a little deeper here. Look at skilled care. So that would be like nursing, therapy care that only can be safely and effectively performed under the provision and supervision of a licensed professional or a technical person. So it might be an RN, and they might be giving physical therapy, speech therapy, occupational therapy. They could be short term, or it could be, if you've rehabbed from an illness, that would be a reason that you would need skilled care. Some examples also would be a wound care or some kind of IV therapy based on what's happening in terms of an infection, or different injections, or monitoring of your vital signs and durable medical equipment. Those are skilled care issues. And it can be given in your home by, as I said, licensed nurses or therapists through certain providers. And if it's prescribed by the doctor, then this is going to be covered by Medicare, maybe some private insurance, if you have veterans benefits, and some long-term care insurance policies. If your in-home skilled care services aren't enough, you might need to consider a move to what's called an assisted living facility or a personal care home. So these facilities have a very wide range of services who want to be, stay a little bit independent, but they need some help with their activities of daily living. There are care plans, but there isn't an RN that usually advises the care plan, but there is not 24/7 care. If a resident at home with skilled care needs more, they might have to hire some additional support or move to 24-hour, 7-day-a-week or 24/7 needs. And those are typically in a skilled nursing facility or a nursing home. So the person, your loved one or you, just needs much more help. And these stays can be short-term or they can be long-term, depending on the prognosis and whether rehab is successful or not. And when you're looking at these needs, if you're using a family member as your caregiver, honestly, that really only works for the short term, because family caregiver burnout happens. Remaining the caregiver for a loved one is exhausting, and it can take a toll on your own body. There's always a risk that you could injure yourself while caring for your loved one and transferring them from point A to point B. So it is a consideration. So let's look, if you or your loved one need 24/7 care, what are the nursing home options? So there are standalone nursing homes that don't have an affiliation with a hospital. There are those that are part of a hospital or right next to it. So if something would happen to you, it's really easy to get care from the neighboring hospital. Sort of an insurance policy if something goes wrong. And then finally, there are nursing homes that are part of continuing care retirement communities, often known as CCRCs. So if you plan ahead and you have sufficient financial means, this is the most ideal because you might be fine at home, but you're looking ahead and you say, there may be a time where I don't want to deal with mowing the lawn or repairing things around the house, but I want to stay independent. So a CCRC has three really levels where you can start an independent living in a small house, in an apartment. They all vary within the different CCRCs. So you can do your own things. If your healthcare needs change, you can progress and maybe just stay in that house or the apartment and get assisted living facility kind of level of care. And if something were to happen farther down the road, there's also the 24/7 skilled nursing facility option as well. This is something that you would typically buy into when you first go into the CCRC. And that process itself can be quite overwhelming and you need some time to do it. And I suggest that you have an appointment with a certified elder law attorney and look over those contracts and see the pluses and minuses. And also, especially when it comes to your money and the like. So how do you pay for all of this? If you're looking to find the right nursing home down the line, cost is a factor. So let's just step back and think about how much does it cost yearly, on average in Pennsylvania to stay at a 24/7 skilled nursing facility. So currently that number is in excess of $133,000. And statistics tell us that the average stay in a nursing home for people that go is between 2.5 years. So if you go to the nursing home and you stay for 2.5 years, you're spending over $330,000 based on these average numbers. That's quite a bit of money and will easily devastate many families' savings. So you want to look at, when you look at the facilities, do they accept Medicare and do they accept Medicaid? This will help with your payment options. There is not a government benefit that automatically pays for long-term care at home or in a nursing home. You have essentially three choices. So you can private pay, as I said, with that high rate. You could come and get long-term care insurance if you qualify ahead of time. In other words, before there are any health issues. Or you can take some steps to accelerate your eligibility for a government program called Medicaid. So there are two government programs we're going to just discuss here, Medicare and Medicaid. And Medicare is more like the federal government's health insurance program. It covers most of your medical care with your supplement that your physician does for you, or hospitalization, but very, very limited in terms of long-term care in a skilled nursing facility coverage. At most, under the current law, the most that Medicare will pay for your time in a skilled nursing facility is a max of 100 days for a term of illness, a spell of illness. And very few people get the 100 days of coverage these days. So it's short term. Medicare is a short term part of the plan. Medicaid, on the other hand, is the joint state and federal program where eligibility is based in certain part on your asset level. So how much money that you have. So if you're entering the nursing home, the amount of assets that the person applying for Medicaid can keep is very, very limited. Right now, those available assets So the things that when you tell all about your finances that are in the available column would be listed and limited at $2,400 for most people. So you can't keep a lot of money and get on Medicaid. Honestly, we have other webinars on our paafterlaw.com. Just click on our YouTube channel. If you want to know more in detail about the qualifying for Medicaid and how the available and the unavailable assets are determined. But when we meet with people, especially when we can meet with them in person in non-COVID, we illustrate all of this on the whiteboard. If you're like me, I'm more visual, and you can see things. So much different eligibility for Medicaid for a single individual than for a married couple. If it was a married couple, for example, the rules are the same for the person entering the nursing home. They can only have a couple $1,000s in assets. However, there are protections for the spouse at home, sometimes known as the community spouse, where they can keep some of the available assets and may be able to keep them all depending on what's going on. So you don't want to wait till the last minute, or if you're married, necessarily just keep paying the bill. There may be ways to have your loved one eligible for Medicaid and still preserve the assets for you, the spouse at home, for what you need during your lifetime. So the other possible payment methods, one I already talked about, long-term care insurance, private payment, and then the veterans benefits. That would be a separate discussion, and we do have a webinar on that topic by Attorney Parker, my law partner. So if you are a veteran, you served during a period of wartime, or your deceased spouse was, and you were other than dishonorably discharged, and you meet certain resource and income requirements, you could be eligible for a monthly pension called aid and attendance. All right, now once you've figured out what the needs are, how complex they are, how much money you have, where you want to spend it, and how you want to spend it, you go off to start looking at these nursing homes. So if you're able to have an in-person tour, very few people are allowing that currently, facilities with the COVID guidelines, but some have virtual tours, and there's nothing keeping you from doing a drive-by. So staff's important, but don't judge appearance on the building alone. So this is sort of like buying a house. You may do a couple drive-throughs. If you're buying a house, is curb appeal, but what I'm saying is if it's a nursing home for your loved one, the building doesn't have to look perfect. It's the people. Who's managing it? Who's taking care of your loved one? Are they getting good care? Think about the demeanor of the staff, whether you're seeing them in person, you're seeing them virtually, you're talking to them on the phone. If they're lovely and kind with you, chances are they have that part of their personality when they're working with your loved one. If they're not so lovely and kind with you, and you're, shopping to see bringing your loved one to the nursing home, that's probably a big strike. What other factors should you consider? So some of these things you can observe if you are inside the facility, and many of these things, if you can't get inside the facility, you can ask the questions. So what is the staff to resident ratio? Do you see adequate staff on duty? So for example, if you were walking up the hall and a couple of times you hear the same resident hitting their button, and buttons are going off all over the place and nobody is going to attend to them, that's a concern. Are the staff members interacting with the residents? So are they saying hello in the common areas, going out of their way to greet the person? This is going to be your home or your loved one's home. You want people to be pleasant, friendly, respectful, like are the staff and the management treating your loved one or you as if you're a member of their family. That's really what you would like. Do they knock on the door before they enter the rooms? You wouldn't want somebody to just fly in your bedroom door at the house without announcing and coming in. Do they call residents by their names? Boy, I would like, be great. Somebody says to me, "Good morning, Tammy. How are you doing?" As opposed to, "It's time for your meds." Um, very different considerations. Now, if you can, speak to the floor staff. So if you're in there, great. Be respectful. They have a job to do. If you see them standing at one of the little computers affixed to the wall, entering things or counting pills and meds, might not be the best time to approach, but ask how long they've been at the facility. If you can't get in, this is a question you can put on your list for either your virtual Zoom interview or call or email. How long has your average staff been there? And ask for it to be broken down from nurses to, all of the categories of possibilities. If they've been there a long time, it's usually a positive sign that it's a respectful place to work. As a whole, I will tell you that nursing home staff the turnover is very high. It's hard to find good workers. They're in short supply. Um, so bear that in mind. Also, ask what the philosophy of care is. If the first person you talk to can't answer this, the management, that's a problem. You can go onto the website, and most of the facilities have this on their website. Are they about the residents? What if you or your loved one had a specific need that needed to be accommodated? Often that's a dietary need or some kind of allergy or just a dislike. Um, do they accommodate them? How is it done? What if there's a conflict or other issues? So, oftentimes I'll tell a little story. Some of my family members have been in facilities, and especially my Aunt May would tell me great stories when she was at the assisted living and then the nursing home level about, because there are way more women than men, um, the men having multiple desires and likes of women, and the women not being real happy, and they'll becoming big, big, big problems and conflicts about how that works out. Now, that may sound silly, but again, this is your home, this is your life. They want to know how to deal with it. It might be moving somebody. If you're in a nursing facility and you're sharing a room, and that person is a loud talker or just is on their phone or blares their television loud every day, how do they address that? Each facility would have an ombudsman, but it's good to just find out. It's a good question to ask. Look at the other residents. So what are they doing? Do they seem happy? Are they in the common areas? Do they interact? Are they talking to staff, or are they just sort of depressed, ambling along? That's important. Try to speak to them if you can. Ask how long they've been at the facility. Did they move from their residence? Food's a big issue. Do they like the food? What are the activities that they like? Are there planned outings? And again, pre-COVID, many of the facilities, whether they're personal care homes or skilled nursing, have opportunities for people, for example, to go in the van and take a ride in the fall to look at the leaves as they're changing, or to go to the local ice cream place to get homemade ice cream. Ask about those. Many facilities have monthly, weekly, sometimes daily activities like bingo or church services. Ask who runs those. How do you get to them? And if you're there, ask to share a meal, like hang out and have dinner or lunch with somebody. In addition to on-site inspection or Zoom inspection, whatever's going on, there are reports and ratings. So on Medicare.gov and various other places, you can look to see how each facility is rated. Have they been written up for a violation? Now that we have COVID issues, those materials are there as well. You may even want to ask the administrator, well, what happens? Am I going to be able to see my loved one or not? Most, all the facilities are going to follow the CDC recommendations, but some are creating opportunities for outside visits. Very, very important. You want to see your loved one. What's the location? So, as you age and you need or choose to go to a nursing facility, you might feel lonely and you may be bored. Things are changed. Instead of a whole house or whole apartment, you're now having downsized to one room and maybe a room you share with somebody. And so you might be bored. You don't have all the opportunities to do things. It's important to know that your family or friends can come visit. How far away are they? Is it accessible? Will they come? Ask the hard questions. If it's you that's making the decision, look internally and say, boy, who do I need to see? And it may be a friend that's more important to you than a family member, and the friend may be closer to a facility that you choose. Do they have car? Can they come get you? Can they take you for a ride? Is there somebody there that you know from your hometown or that maybe you grew up with, or another one of your siblings is there? Really important. I hear lovely stories about my clients reconnecting with somebody they knew in grade school. Many opportunities to reminisce, compare notes, and have just somebody to talk to. If you need some help with that, there are professional care managers that you can hire that would help you find the best facility. So as I said, visit and observe. Look at the outside. This is really important now with COVID considerations. Is there a safe outdoor space for the residents? Get out, get fresh air, see people. Some facilities have outdoor swings or even some outdoor workout equipment. If you're seeing the people outside, are they dressed appropriately? Do they have little blankets if it's cold? Do they have everything on? Are the residents, wearing clean clothes, maybe jewelry, makeup? People look happy. And are they participating in the outside activities? Are the common rooms being used? Or is every time you've gone in there or had a virtual visit, you see nobody around the fireplace with the chairs? Ask lots of questions. If I didn't say it enough already, you got to feel comfortable. If you're moving there and your family, if you are moving a family member, you want it to be a safe place for them to be. And as I mentioned, you want to start this before the crisis. Any decision, no matter what it is not as good if you have to make it with stressors in effect. So you might need follow-up visits. You might need follow-up phone calls. You might talk to people. That gives you some time. If you want to hire a care manager, call your family and friends and ask them about their recommendations. Very, very important. I thank you for joining me today. We will have this on our YouTube page soon. And if you have come up with any questions that I didn't address and you want to talk further, you can call us at 1-800-401-4552 to schedule an appointment, or you can email us at webmail, webmail.com, at palderlaw.com. Thank you so much. Take care and be safe.